Hi all, and welcome to Anatomy and Physiology 2. The course code for this is Bio 102, BIO 102. This is an online course where the lecture and lab are both going to be taught online. There are a lot of videos for you to watch, a lot of assignments for you to submit through the computer, but there is no requirement for you and I to have face-to-face or Zoom sessions together. We can use Zoom sessions if need be, office hours and so forth, but you will not need, there are no requirements for you to be at a certain time to meet with the class. Needless to say, you don't need to come to the campus at all. Okay, so my name is Dr. Gamaro. So this is me. I want to welcome you all to Anatomy and Physiology. Let me switch off of this for a moment and do the real me for the moment. There I am with my two buddies over here. So I want to welcome you to Anatomy and Physiology. My name is Dr. Gamaro. So this is part 2 of our continuing saga of A&P. I just want to let you know before I talk about myself, you're going to need to print out the syllabus. It's a whopping 34 pages. The first 9 pages, first 8 pages. First 8 pages are what we refer to as the departmental syllabus, which is the same information that all Anatomy and Physiology 2 students get, whether you take it as an online course, a hybrid course, a live course, it's all the same. And then what I'm going to be spending time on, you can read that on your own, those first 8 pages, but what I'm going to spend time on is the starting on page 9, which is actually my addendum to it, which is the bigger part. You'll see on page 9, it has like a yellow box up here, okay? So before I go into the syllabus, I want to tell you a little bit about myself. My name's Dr. Gamaro. I was born and raised in New Jersey, Newark, and then my family moved up, I guess when I was about 8 years old, to Sussex County to a town called Ogdensburg. And then I graduated there, high school and so forth. Then I did my undergrad at Ohio University, where I graduated with a BS in pre-med zoology. Then I went into medical school. I went to St. George's University School of Medicine. That's actually in a little Caribbean island called Grenada. So I did my 4 years there. Actually, I do the first 2 years on Grenada, in the island of Grenada, and also St. Vincent was a nearby Caribbean island there too. And the first 2 years is the book stuff, the stuff that you're doing right now, where you're sitting down in a class and you're learning about anatomy, physiology, microbiology, biochemistry, and you're writing all that information. And then the last 2 years we refer to as the clinical years. The clinical years is where we take all our knowledge that we learned in the first 2 years and we practice on real patients in the hospital. I had the opportunity to go to England to do a year and a half of these clinical years. And I thought it was a good idea where I could actually bridge my two loves of medicine and traveling. So I went over there for a year and a half. Different way of learning things. I mean, it's socialized medicine. It won't work in America, but that's another talk for another time. But we do spend, in England, people always do spend a lot of time on physical diagnosis. Not that they don't do diagnostic testing, blood tests and imaging and stuff, but because they're socialized medicine, there's a lot more emphasis to make sure that doctors are not wasting money, so to say, just because they want to confirm something by doing a lab test. It kind of cuts down on money. In America, it's a little bit different because the word sue is in someone's name. It's a verb. And there's a lot more of that going on. So I think in America, there's a little bit more defensive medicine, so to say. There is hands-on, obviously, but I think they just want to make sure it's not cancer, it's not something bad. So we're going to do the test anyway. So why do we need to do all this physical examination. I got mixed feelings about that. But anyway, I carried over that material, that learning experience to the States, and I carried on with that. So I did medical school, and then I went into the field of obstetrics and gynecology. I did 5 years of a residency with that, and I delivered 3,000 babies during that time. I lost track after that. And then I needed some time. My mother had a stroke. She's doing well now. I had to get some knee surgery. This was a good opportunity for me to step back from working as a doctor and take care of those personal items. And as this was all happening on this little break from medicine, medicine itself was changing. It wasn't what I signed up for, if you want to put it that way. I just find that the patients, they'll go into a large waiting room, then they'll put them in a small waiting room, and then someone takes your blood pressure and temperature, that person leaves, another person comes in, asks you a lot of questions, examines you, that person leaves, and another person comes in. I'm like, who are you? Oh, I'm Dr. So-and-so. You're Dr. So-and-so. Who's the one that examining over here? Oh, that's the nurse practitioner. That was the physician assistant, and then you had the nurse, nurses' aides and things like that would do blood pressure. So I felt that it was being more of an assembly line, and the doctor would only would spend time with me for about 5 or 10 minutes. And rely on the other people's examination, but would do the more focused examination for himself or herself to get the better understanding of what diagnosis it is. I don't know. I just thought not just for me, I started seeing it changing when I was working as a doctor. And it didn't really, like I said, I didn't sign up for that. And it just, I'd rather do all the examinations and all my, everything by myself to get that and challenge myself and to grow with that. It wasn't going that way because they were giving me more and more patients. You couldn't, I mean, if I would have to go home at midnight to take, if I have to see all the patients. So I get it, I understand. But anyway, to make a long story short, that was one of the many reasons I stepped back from medicine, at least the clinical aspect. And I was talking to people. I said, just out of curiosity, what else could I do with my medical degree? And someone mentioned teaching. And I'm like, I mean, I teach medical students, junior residents. I don't know. So anyway, make a long story short, here I am almost 20 years later and loving it. I do a few different colleges. Mostly I teach anatomy and physiology. Pathophysiology is my favorite course, which is basically diseases and how they come about. What's the whole trajectory of how this disease happens. Teach biology, microbiology, medical terminology, all these different courses. But mainly now it's mostly anatomy and physiology. And I work with a lot of people who are going into the nursing venture or the respiratory therapy or physical therapy or doctor or nutritionists. The list can go on and on, but they're mostly medical careers that they're doing. So I'm giving back. I'm giving back to the community. I've done the clinical years for a number of years. But now I want to do the other branch. Instead of clinical branch of medicine, let's do the educational branch. And like I said, I'm loving it. I'm watching the students grow, if you want to say that. I get some thank yous now, but I definitely get thank yous about 2 years later, and they realize what I was doing with them to try and wire their brain for nursing or wherever they're going to be going. And I know the things that every medical professional that would be taking this course needs to know. I've been following a lot of the tests, like the nursing test, the NCLEX, which is the licensure exam. I've seen things how how things are changing. They're getting more diagnostic. They just changed it April of 2023, the NCLEX, and there is more diagnosis happening over here. So things are changing. But anyway, that's a little bit about where I am right now. But really where I am, I'm actually in Boston. I used to teach at CCM probably like 2008 to 2016, something like that, anatomy and physiology. Then I recently got married. It was easier for me to relocate, so I moved up to Boston and teaching a couple colleges up here. And it was during the pandemic that I just made a phone call to CCM because and it's not, I'm not trying to sell this, but CCM is one of the top, I think it's ranked, when I was there, it was ranked like 10 years ago, and I'm sure it's still up there. It's ranked like 19th of all community colleges in the nation. So it's pretty high up there, and that's where I want to be. Anyway, I called up the administration over there. I said, "You want me back?" And they said, "With open arms, absolutely." So during the pandemic, I've been doing a lot of the online kind of courses for anatomy and physiology 1 and 2. So I've been doing that, and of course, I'm doing live and hybrid courses in Massachusetts. So that's a little bit about myself and where I am and why I got to this point. But anyway, I would imagine everybody in our class is going into the health field. A&P1, you get a few people, computer science, psychology, but A&P2, it's really I can't imagine anyone's taking this for fun. Yeah, I think this is going to be a foundation. You're going to see the way I teach this. If you haven't had me before, you're going to see the way I teach this is to put a disease in there. It is so vital to put a disease in there because it gives the normal stuff kind of a significance. What's the purpose? Why do we need to know the normal? Well, here's a disease. If we remove this, then how is that person going to present? How's that patient going to present? Now it makes sense. Let's say you have a stroke, a decrease of amount of blood going to the occipital lobe of the brain. Well, if you remember from A&P1, the occipital lobe of the brain is interpreting vision. So I would imagine that he's not going to be seeing very well, that he's interpreting. He could see it, but he doesn't recognize what it is. In other words, things, and this is an exaggeration, but it's basically interpreting. Sir, can you hand me the hat? And he hands you a glove. And it looks like a hat to him, but he's handing you a glove and he doesn't know why you're confused. It's that kind of thing. So some teachers like to say, what is the function of the occipital lobe? I'm doing like the opposite, but asking the same thing and say, what if the occipital lobe was removed? Then that person will not be able to do what? It's the same thing, but I'm kind of giving you a clinical aspect of why it's important to know that, okay? All right, so let's go into the syllabus. Again, the first 8 pages of the syllabus, make sure you print this out. Put me on pause if you want, print it out, and you're going to follow along with me. I'm going to do the whole thing for you. And then afterwards, you're going to have to do a syllabus quiz, a 10 multiple choice question thing that's worth 1% of your grade. So it's important that you go through this. The first 8 pages is a departmental area that everybody in A&P2 will be doing, but I'm going to start on page 9, which is has this yellow box up here, and that's really my aspect to this whole thing. So yeah, I doubt very much. It's 34 pages, give or take pages. I think it's important that you know what's going on with here, and I don't think that everybody will be reading it. So I'll read it for you, or I'll actually I have a little PowerPoint presentation that'll go with it. So again, the first 8, 9, or 10 pages depends on what semester you are, or is it departmental, but you're looking for the page around 9 or 10 that has this yellow box, and of course my name's right on here, Dr. Gamaro. But it is about 34, 35, 36 pages or so. Okay. So I'm going to switch over and we're going to go back to my PowerPoint. So let me do that right now. Okay, so here's me again. So let me go. Here we go. All right, so all right, so the first thing you're going to need to do, and I'll show you everything. Everything is on Blackboard, which is our learning management system that CCM has chosen for us to use. So the first thing I want you to do, and I'll show you where that is to do this questionnaire. It's not going to take you long to do. It's just to better acquaint myself with your background, what's your name, what do you want to be called, do you have a degree in something, what's your major, are you taking other courses with this, and so forth. Online students, which is you, I would want you to go to the syllabus folder. You'll see what that is. Download it, complete it, and then save it. Usually you want to save it as change the file name to maybe your own name, and then email it to me. Get this off the checklist. Put that nice, wonderful X I'll be saying every so often in this tutorial. It's always nice to put that X in that checkbox. So just do it on day one, get it out of the way. It's easy to do. It's very easy. Okay. So the course description, again, you got to see this as part 2 of our anatomy and physiology and all the functions of our body. Think of it, as I've always told people, as a manual about yourself. Always keep in mind that this is not a 15-week course, or if some of you are taking a 7-week or 10-week. You really need 2 parts to this, right? You really need it. If you're going to take it as 15 weeks, it's really 30 weeks. So keep this in mind. Whatever you learn from A&P 1, we won't have time to go over it or review it, but you're surely going to need to know that material to deal with the material in A&P 2. For instance, we expect you to know the sympathetic and parasympathetic of the autonomic nervous system, because that comes up so often throughout this whole semester. Likewise, we're going to see in the cardiology, the action potential. Yeah, the action potential is coming back. We're going to see a little graph of that. So you need to know what depolarization is and repolarization, and understand what actually causes that and so forth. So you're going to need to know that stuff. If you are rusty on that, or you haven't taken A&P 1 for a while, then just everything is in the textbook. So you can go over there and read it yourself to review it. Okay. It's highly condensed, as you know, especially if this is taken as a late start or in the summer. These are usually the 5-week, 7-week, and 10-week semesters. And if online, which it is, that has its own challenges, as you know. But I'm going to email you quite often throughout this semester, and you'll feel as though I'm present, okay? All right, so this course, like I said, it's a continuation of anatomy and physiology. It has this course in A&P 2 has anywhere from 10 to 13 systems, body systems we're talking about. Why am I hesitating about that? Well, you got some over here, like cardiology is considered one, the vascular is considered one, but some people like to put these together and call cardiovascular. Some people put these separately as urology, their urinary system. Some of them like to separate it with the fluids, electrolytes, and acid base. That's another system. It's another chapter in your book. There's also nutrition. I kind of put that into digestion. That's another kind of system. It kind of correlates with that. Reproductive system, well, we also have to deal with not just the male and female, but we've got to talk about pregnancy and embryology and so forth. So that's another chapter in itself. So it depends on how you look at it. It's roughly, I consider about like 10 systems or so. Okay. Now, because we're taking this online, there is 5 requirements. Now, if you're following along with me with the syllabus in hand, we're now going to be venturing on roughly, it depends on what course, but it should be around 10 on page 10 and page 11 of the course syllabus. Okay, and 12. So anywhere from 10 to 12, you're going to see it in there. The 5 specific online requirements for A&P, or for an online course. So the first thing is going to be a digital device. You're going to need a laptop, desktop, or Chromebook for everything. Okay, everything will be used, that including the exams. Do not use smartphones or tablets for any kind of quiz or exam. It's just not compatible with Blackboard. You could use them, obviously, if you want to look at, read the e-text of the book, or if you want to watch my videos, sure, you can do that, but I would not use them for any kind of exam or quiz or mastering A&P, okay, which is the lab component. The other thing you're going to need is obviously internet access. Now, these things are all pretty common sense, but I need to put some extra things in here to make sure you're going to be doing, have these items. You need a very good Wi-Fi connectivity. If you have it in your house, the router, which is that blinking box, the modem is actually in your computer, but the router is that thing that has that blinking light, like 4 or 5 blinking lights. That's called the router. If you are near that router, it becomes a little bit more of a priority for the router to go to your computer first. That's always a good thing. You're going to need a strong connection where you're going to have, you should have at least 20 megabytes per second. Now, there's an issue with this because you need at least 20 megabytes per second throughout the whole exam. So it might be 20 megabytes at the beginning, but then someone comes into your house and wants to play a video game, or they want to watch Netflix or something. Well, that brings down the megabytes per second. And while you're taking the exam, if it's not 20 megabytes per second, it will slow down going from question to question and so forth. If it goes really slow, it might even bump you off the exam. So make sure you have a strong connection, but be very mindful of the internet traffic. I just want to mention that, as I told you before, anybody playing videos, YouTube, or watching movies on Netflix, any video or streaming, and also action video games, that really eats up all of this megabytes per second. So just giving you a heads up about that. The exams and just reading your emails, that doesn't do much, but it's this streaming and video gaming that actually does eat up that. So you need to make sure that you do have a good, strong connectivity. If you're unsure, no big thing. Just go to the school on campus and take the exams. If you're indoors, all the buildings have a very strong connection. You won't have to worry about it ever dropping or anything like that. So if you need to, you can go on campus. Indoors would be best. You could do it in the library. You could go into maybe a computer lab or something and do the exams. It's quite all right. Only use Google Chrome. You cannot use Internet Explorer, Internet Explorer Edge, Firefox, believe it or not, and for Apple users, Safari, especially for the exams. The quizzes that are going to be used, that are going to be proctored by something we use, Smarter Proctoring, which is a third party that is going to proctor the exam, and then I'll look at the video recordings. They don't work with Firefox and Safari, and there's been issues with Internet Explorers, but there is nothing wrong with everything. The proctoring, the exams, the videos of the video lectures, submitting the lab reports and so forth. If you use Google Chrome, there is no issues with that at all. So I would just put it on Google Chrome and just do that, okay? All right, so the third thing you're going to need is a webcam with a microphone. Again, you're going to be needing it for Smarter Proctoring. Again, that's our proctoring service we're going to use. And if there is any virtual appointments that you and I want to have, i.e. the office hours, we'll be using that. I usually use Zoom. Okay, the webcam must be positioned at the top of the screen, not on either side of your screen. It has to be at the top. This is required by the proctoring service, so it has to be on top. You're going to have to do a 360-degree pan of the area around you. Okay, so at eye level, you should have not just eye level, a little bit higher and a little bit lower. I need to know what your area looks like, to make sure that there is no diagrams, notes that are taped to the wall, that kind of thing. And I will be asking every student to do that so that it's fair for everyone. I will also ask you to show either side of your desktop or during the 360 degree, just point it down when you pick up your webcam, just point it down so that I could see what your desk area looks like, that there's no books, there's no papers or anything like that that would aid you for the exams, because none of this is going to be open book. And then when you're done, just put it right back onto the top of the screen. I understand that if you have a webcam that's embedded into the screen of your laptop or your Chromebook, then just pick up the whole thing and just do a sweep throughout the whole area, 360 degree. That's totally fine. Okay. If it's a desktop, just give me an email. I will give you some idea. Mainly that you would probably use like a small mirror and kind of use it like a rear view mirror and point it to the webcam so I could see what your area looks like. But email me if there's any issues with that. Okay. All the exams, like I said, are going to be video recorded. I should be directed at the monitor at all times. Again, no exam or quiz is going to be open book. All right. So, and you will not be able to go to any other websites, Google and so forth, that some students say, oh, I could do. You can't. It's actually locked. And I will be alerted if you try to do that. Okay. The fourth thing is a photo ID, an ID that actually has your photo on it. It could be your school ID, which is probably the easiest thing for you to do, but any government issued photo ID, like a driver's license or a passport, is fine also. Your full name must match what I have on my roster. Okay. Make sure it's not expired. It will be flagged if it's expired. So do make sure it's not expired. And you're going to need to display it. Bring it pretty close to the webcam. A lot of times they put, the students put it right next to their chest, and it's like you can't even read it or see it. So just be sure that you hold it up until it tells you that the picture was taken, but you're going to have to hold it close up to the screen. Okay. And the Smart Approximate will prompt you to do that. The last thing you're going to need is a lab kit. Okay. I emailed everyone a few weeks ago about getting this lab kit. You are going to be using this pretty shortly. Lab report number 2 on the heart, we're going to be using it. The first lab report we're not, but depending on if you're taking this as 7 weeks or 5 weeks or 15 weeks, the second lab report might be the same week as the second week. Might be the first week, but you need to have this, and it does take a couple of weeks to receive it. So you got to do this today if you don't have it. You will order it directly from Carolina Biological Supplies. I sent everything. There's also going to be an area in Blackboard where you can see the instructions. And you should have your lab kit. If you've done all this, you should have the lab kit now or by the end of this week. In the lab kit, sorry, it's not these things. There are 3 things there. There's actually a few things. First off, you're going to have 2 dissection things, not the sheep brain. Obviously, I copy this from A&P1. Sorry about that. You will have a sheep heart, okay, and you'll have a fetal pig in there. Don't remove them out of the bags until we do that, because I don't want them to dry up. And don't ever dispose them afterwards, because we do use them more than once in other lab reports. You also get a dissecting kit, goggles, gloves, and a lab apron. The other thing you're going to get is you're going to have a blood pressure cuff and also a stethoscope, because one of the labs that we're going to do is that we're going to be taking blood pressures. We're going to listen to the heart and so forth. And yes, you get to keep these. So that's another good thing. So this may be the first stethoscope you ever have. It's going to be a milestone. Okay. You'll probably keep it forever and ever. And you'll get the more nicer ones when you get, when you're actually in your jobs. But, it's a little bit of nostalgia for you. You can store this in the refrigerator. It's not necessary. The the specimens, the sheep heart and the pig. Just put it in a cool place, room temperature. A garage is probably ideal to put that, to keep that. So if you want to keep it there until we use it, that's fine. You don't want to keep it outside. I know it could, it could be cool out there. It might be summer. It might be, the summer, it's not going to look good. And when it freezes, it's not going to be looking good. But keep in mind, it's also a place where little critters might be looking for food. And believe it or not, they'll open that up and don't ask. So just keep it in, I think the garage is probably the best place, room temperature. Okay. And again, just don't throw out anything. Okay. The course objectives, you'll see them actually in the, where is it? Yes, you will see it in the syllabus, what the objectives are, but that's towards the beginning. That's in the departmental area. So I'm not going to spend time talking about that. There's also a copy of it in the syllabus folder of Blackboard. Okay, so you can just read that on your own. All right, some course information. We're now on page 13, 14, 12, 13, or 14. And you'll see on the top, it says course information. So the prerequisite is really just getting a C in A&P 1. The class dates, it depends on which semester this is, because I use this recording for many semesters. And it's 4 credits, the exams, quizzes, and lab reports. Since everything is done online, it's remotely done. Times will vary, obviously, and days would vary. But you'll see where that all is, okay? Again, my name is Dr. Gamaro. I don't have really office hours. Email me. I check my emails often, like 2 to 3 times a day, every day. Email me. If I could answer through an email, and that answers your question, super. If it doesn't, I have no problems at all to do a Zoom session with you that a time that's conducive for you and I. I could do it on Saturdays, Sundays, Mondays. But it depends on me too if I'm doing something. I could even do it on holidays too. But yeah, so give me a email and see what we can do with that. The contact information, faculty offices, if for some reason you're not getting an answer from me, that's unlikely, highly unlikely. But if you need to get a quick answer of what's going on, you can call up the faculty offices, which is the phone numbers there. I also have the CCM email, which is escamaro@ccm.edu. But I want you to refrain from using that. Only use that before day 1, okay? Because you can't get into Blackboard until day 1. But what I want you to use is what I call the Blackboard mail. I'll show you where that is. This is where you're going to be conditioned to check. You yourself will check it at least twice a day, maybe in the morning and then the evening, maybe 10 o'clock in the morning and 6 o'clock, and do at night, and do this all the time. Make it a routine for you to do, because I have a tendency of emailing things, maybe nothing at all, to like 2, maybe 3 times a day, some kind of pointers, some kind of study tips, or important information that you need to do for a lab report. So do check that. I will be doing the same thing. I will be checking it quite often. Like I said, 2 to 3 times a day, and every day. Holidays, Valentine's Day. My wife wouldn't be too happy with that. But Super Bowl Sunday, I check all the time. So again, just email me through Blackboard mail only after day 1, okay, throughout the whole semester. Okay, so these are the same online course requirements. It's just put here on one page, a little bit easier to see, but just some highlights. Make sure you have a digital device. Remember, desktop, laptop, and Chromebook are the only 3 items that you can use for everything here. Tablets and smartphones you can't use for exams or quizzes, or even mastering A&P. Again, with the internet access, you need a strong connection. That's not 15. Some students were using 15. It wasn't working. It is 20 megabytes per second that you need, okay? And mind the internet traffic in your house. You can use the school. Like I said, you could go to campus. As long as you're indoors, any of the buildings have very, very good connection for your computer. Okay. And only use Google Chrome. Remember all those other ones, including Firefox and Safari and Internet Explorer, those will not work with everything here, especially exams. So make sure everything is done through Google Chrome. You also need to have a webcam with a microphone, a photo ID, and the lab kit, which I spent time talking about. Okay. Okay, so let's talk about smarter proctoring. Okay, you do, like I said, it's a 24/7 online proctoring service that CCM has chosen to use. Again, it only works on Google Chrome. So if you take an exam, it won't even allow you to take the exam if you're using Firefox. You have to use Google Chrome. Once you do it for the first time, you're going to need to download and install this thing called the Smarter Proctoring extension. It goes right onto your browser. You got to make an account with them so that you could always take the exams that way. And you could do this with the syllabus quiz. Remember, I told you that quiz that you have to do at the end of my little talk over here. You'll see all the instructions that are found in the Blackboard course, and I'll show you what that is. You'll also need to do mastering A&P. You can't set this up. You cannot set this up, sorry, until day one, because you have to do it through Blackboard. Do not, I repeat, do not go through the website of masteringamp.com. I have it so that Mastering A&P is integrated actually into Blackboard. So there is no so-called course code. If you're asking for a course code, that's for someone who does a course, but it doesn't go into the Blackboard. And I have it going into the Blackboard, so you don't need a course code. They already know what the course is because I've connected it, so to say. What you do need is an access code that you have to purchase. If you've had it for A&P1, it might have expired. You might have bought the 18-week price for it or the 18-month, and it could have expired. If it expired, you're going to have to repurchase a new one. Okay, it'll show someplace on your account when it will expire, because if it actually expires during our semester, you're still going to need to purchase another access code and then pop it into the when it calls it, and then you have to and then you'll be able to use it. Okay. All right, so the textbooks, we're still on that same page, by the way, that says course information. So the textbooks, in conjunction with this course, the Anatomy and Physiology textbook, the 11th edition, the 2019 edition. I know it sounds like pretty old, but to tell you the truth, anatomy, they haven't changed it. They haven't gone to the 12th edition. And to tell you the truth, it really doesn't matter, because I'll be honest with you, anatomy has not changed for the past, 100 years? Now, physiology, I wouldn't say it's changed, but was once an itch is now an allergy. I mean, it was always there. We just didn't know what it was. But to tell you the truth, it hasn't changed since 2019 as of right now. Okay. But you will know if there's going to be a new edition by me sending an email about that. But it is, the author is, I guess you pronounce it Marib, but that's what that is. For the lab, hey, you don't have to buy a lab manual. One is actually given to you once day one happens. You'll see where that is. It'll be called something like a lab guide manual, or the laboratory guide, or the laboratory manual. It's all the same thing. You'll see it in Blackboard. It's about 100 pages, give or take 10 pages or so. And all the lab assignments, I refer to them as lab reports, etc., will be found in the Blackboard. And you're also going to be using, like I said, Pearson's Mastering A&P.